Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. We are from SGD B1. In this opportunity, we would like to present our student project with the title Elderly Travel. Next. So here are the members of SGD B1. Next. Here's our preview of the contents. Next. Okay, for the background of our student project, in the recent years, there has been increasing in life expectancy that the future generation will have higher life expectancy with lower fertility rate. The increasing population of the elderly will contribute to the demographic structural change and pattern that cause the increasing of elderly traveler. Mobility is critical to improve an individual's quality of life regardless of the age because it's the basic aspect of the activity daily living, also to maintain independence as people get older. The choice of travel mode varies depends on age group because of several influencing factors such as health factors and physical limitation. Several things should be considered for elderly traveler are the accommodation made mode of traveler as well as the physical ability and health. Next. The purpose of our study to know travel planning for elderly, to know general fit to travel assessment for elderly, to know the methods of traveling for elderly, to know climate variation during traveling, to know medication and travel health kit for elderly, to know routine and travel specific immunization, and to know healthcare accessibility. Next. So the benefit of the study is able to know travel planning for elderly, able to know general fit to travel assessment for elderly, able to know the methods of traveling for elderly, able to know climate variation during traveling, able to know medication and travel health kit for elderly, able to know routine and travel specific immunization, and able to know healthcare accessibility. Next.
Hello everyone, my name is Stevanus with last 3-digit number is 150. So now I will explain about travel planning. Traveling is an activity carried out by a person or more with the characteristic of a geographical displacement from one place to another. Next. Based on statistical data from the World Tourism Organization or WTO, in July 2021, it was found that there were 54 million international tourists who travel and experience the highest increase since April 2020. Gautret et al. Estimate that 15 until 30% of international tourists are people aged 60 years or over. Next. Elder age is a factor that must be considered because there has been a decrease in the body's physiological abilities and an increased risk of contracting the disease. Travel planning is needed as a form of preparation for the increasing needs of elderly, especially to reduce and prevent the risk of developing an adverse medical condition while traveling. Preparation that must be carried out by a traveler include next. Medical examination to identify health history, destination, duration, and method of travel, seek information related to health risks, such as the transmission of infectious disease, determining preventive action, such as implementing immunization and providing certain drugs. Standard related to disease prevention measures when traveling that can be used as a guideline in healthcare are the Yellow Book from Center for Disease Control or CDC, and international travel and health published by the World Health Organization.
My name is Widya with 3-digit number 002. I will explain about general fit to travel assessment. When planning on a long trip, it's necessary to check medical conditions, physical fitness, and mental stability, especially for the elderly who have a higher risk of traveling long distance. The examinations include a history of past and present illnesses, physical examinations, and other supporting and follow-up, such as complete blood count, examinations of thorax and abdomen, eye check-up, and others. Next. These are special assessments of traveler health problems. First, cardiovascular disease. Travelers who will travel with a history of heart disease are sought to be more careful during the trip and also avoid activities that can cause fatigue. Second, respiratory disease. The assessments includes the traveler must be able to walk a distance of 50 meters or by climbing stairs as high as one level without experiencing severe shortness of breath. If this fails, it's mandatory to consult a specialist for further consultations. And last, diabetes mellitus. For travelers with a history of diabetes mellitus, especially those who are dependent on insulin or who are insulin dependent but controlled, it should not pose a particular risk, but it's important to always prepare all equipment, including insulin and syringes. Thank you. That's all for me. Next.
Okay, I will continue. My name is Christian with last digit number 102. I will continue with air travel. In air travel, high incidence of one or even multiple coronary disease in older population is a big factor to consider. Thorough assessment in patient history is critical in determining the need for oxygen supply or other supply, or even rule out the patient from getting into a flight. The next consideration in environmental changes that occurs are DVT risk or defined thrombosis risk. DVT in elderly patients have higher incidence of 1% over 0.1% on general population. These risks are further amplified in air travel with 18% risk increase every 2 hours of long-hour flight duration. Common geriatric disease such as heart problems, diabetes, cancer, rheumatoid arthritis, and other inflammatory conditions are considered risk factors for DVT. Prevention measures such as leg muscle exercise, emulation, compression shocking, and in some cases, anticoagulation prophylaxis may be used accordingly to prevent DVT in flight. In infection disease prevention, passengers who are ill, especially if with fever, should postpone their travel until they have recovered. Infectious disease prevention measures such as routine and travel-specific immunization and assessment of underlying disease and history of related to patient immune system such as HIV and other immunodeficiency disease should be done to prevent disease complication while traveling by air. Other considerations are when flying long distance, older passengers should only bring needed drugs and routine drug schedule must also be adjusted with multiple time zones to prevent overdosage or underdosage consumption of a drug. That's all for me. Next.
Hello, my name is Kirana Herry, and the last 3 digits of my student ID number is 168. And I will explain about sea travel. So before beginning to travel, passengers should consult their health professionals about their health status, travel durations, the destinations, recommended medical condition immunizations, and also particular medications. Mass gathering combined travels from all over the world, which increase the risk of infection disease. Transmission among cruise ships members, persistent environmental contaminations, or exposure to vector-borne disease from port visits from time to time may be the cause of outbreaks. Due to the SARS-CoV-2 outbreak, all travelers should be more aware of the signs and symptoms of COVID-19, get vaccinated, do health protocols properly, and as well as avoid crowding. The risk of severe COVID-19 increases in older people with 60 years old or older, or accompanied by comorbidities. That is why it is best for them to postpone the travel. Most of the health problems are related to respiratory tract infections, motion sickness, injuries, and GI illness, which most GI disease outbreaks have been associated with food or water consumptions on board ships. One of the most common outbreaks on the ship is norovirus, which can cause symptoms such as diarrhea, malaise, and abdominal cramps. The most common cause of mortality in cruise ships is cardiovascular events. That's all from me. Thank you. Next.
Okay, my name is Lustinan with the 3-digit number 210, and I'm going to explain about climate variation. Climate change is having a substantial impact on the regional population's aging, and there are significant internal disparities in the distributions and scales of the migrating old due to different environmental conditions. Climate change has a significant impact on tourism. It is particularly vulnerable to both direct, such as increasing sea levels and rising temperature, and indirect physical consequences, such as changing water availability and spread of certain diseases. Increasing active and reduced motorized transport offer major benefits beyond climate change mitigations, particularly in terms of increasing population's health through increased physical activity and lower local air pollutions, particularly for the elderly. Next.
Thank you. My name is Bertrand Wijaya with 3 last digit name 132, and I'm going to explain about medication and travel health kit. There are some travel recommendations to lessen risk for travelers, such as preparing for exacerbation of chronic disease states, obtaining travel insurance and international healthcare, listing local respected medical institution, and preparing health kit containing prescription and over-the-counter medication, as well as injury or illness prevention that can be seen explicitly on this table. That's all for medication and travel health kit. Thank you. Next.
Hello, my name is Dama with last 3-digit number 036. So basically before traveling, elderly travelers are suggested to have a medical consultation with a travel medicine practitioner. This consultation must be done 1 until 2 months before departure in order to get enough time to complete the immunization, maximal 2 weeks before departure. Schedule and type of immunization that must be taken by the traveler are arranged based on the previous immunization, health condition and risk factor, departure and arrival country or region, and also the travel requirement. In general, immunization that are suggested for traveler are differentiated into 2 categories. First, routine immunization that have been given when childhood in order to fulfill the obligation for national immunization program. However, this immunization status must be reviewed, updated, and ensured that travelers have ever received it. The example of the vaccine are vaccine against tetanus, diphtheria, influenza, COVID-19, pneumococcal disease, poliomyelitis, measles, and other necessary vaccine. Thank you.
Okay, so hello, my name is Amadeus with 3 last digit number 115, and I will continue the explanation about second type of immunization, which is travel-specific immunization. Travel-specific immunization are vaccines that need to be taken by travelers according to the requirements in the visited countries or specific regions. These immunizations are classified into 3 categories. Okay, so the first one is vaccines demanded by specific countries, which include yellow fever vaccine, which is demanded in some African and tropical South American countries, and also meningococcal vaccine, which is important for pilgrims who are going to Saudi Arabia for Haji or Umrah. Second one is vaccine suggested for countries or area with questionable or poor hygienic condition, which includes hepatitis A, which is suggested for countries in Africa, Asia, Central America, and South America, and also typhoid fever, which is suggested for countries in South Asia, Southeast Asia, and Sub-Saharan Africa. And the third category is vaccines suggested for under certain condition, which is based on destination. First one is cholera, which is suggested in Haiti, Dominican Republic, other countries in Africa and also Asia. Second one is Japanese encephalitis, which is required in almost all Asian countries, Northern Australia and Western Pacific. Third one is tick-borne encephalitis, which is recurrent in risk area in Germany, Austria, Switzerland, Italy, Northern, Central, and East Europe. And also last one is rabies, which required in the endemic countries. It is important to remember that all immunization that are required must be accomplished maximal 2 weeks before departure date. Okay, that's all from me. Next one will be presented by my friend.
Hello, my name is Pratama. The 3 last digit student ID number is 061. In this presentation, I will cover about healthcare accessibility. So the healthcare accessibility among elderly travel has become a challenge for elderly to seek healthcare accommodation, especially elderly with many comorbidities. Several factors determine healthcare accessibility include geographic distance, travel time, available modes of transportation, and the departure time of healthcare service. Healthcare accessibility has become important consideration because healthcare accessibility become one of the 3 most common barriers in travel. Several recommendations to be considered for elderly travel. Number 1, travel health insurance. Second, getting healthcare resource for destination country. Number 3, considering using telemedicine. And the last, getting vaccine and bring medication. That is all for my presentation. Next.
Hello, my name is Kirana with last 3 digit 197. So to end this presentation, let me just run over the key points again briefly. On travel mode choice in elderly group, it is important to consider for accessing healthcare because of the vulnerability to transportation barriers and delayed healthcare needs. The information that has been obtained can be the basis for determining preventive action that can be taken, such as implementing immunization and taking drugs that act as prophylaxis before traveling and providing certain drugs that can treat diseases that are at risk of being suffered at the destination of traveling. The examinations include a history of past and present illness, physical examination, and other supporting and follow-up examination. Infectious disease prevention measures such as routine and travel-specific immunization should be done to decrease risk of complication in communicable disease infection. Most health problems are related to respiratory infection, motion sickness, injuries, and gastrointestinal disease or norovirus. A better understanding of the relationship between seasonal movement of the elderly and climate change is urgently required. Healthcare accessibility among elderly travel has become a challenge for elderly to seek healthcare accommodation, especially elderly with many comorbid. Next. Okay, this is the end of our presentation. Thank you for your time and attention. We apologize if we make many mistakes. We will close this presentation with Parama Santi. Om Santi Santi Santi.